Hi, I'm Emily Commesso, and I'm a PGY4 resident in the Otolaryngology program here at Duke University. So when I reflect on my interview here at Duke and when I ultimately made my rank list following that interview, the thing that comes to mind first and foremost is the people. And the people at multiple levels, from the attending level, from the chairman, Dr. Francis, to our program director, Dr. Woodard, but really also the residents. The residents are who you're going to be spending the most time with in a program, and really having that connection with them, to be able to hang out with them in and out of the hospital, to know that there's that trust where you can turn to them when you have questions, to give guidance as you're developing from an intern where you know a little more than what you stepped out the door with from med school, to then becoming a senior resident and having that graduated responsibility. I had a unique interview experience in that my original date had a little bit of a snow out from the north end coming down, and so I had the opportunity to really spend a lot of time with all the residents from all the different years, from interns up to the chief year, and so I came out of that really feeling that I knew them, and I knew that, hey, this is a group of people that I could get along with. And I come from a large family, and so I saw residency as an extension of my family, and now as a fourth-year resident, I can say that that still holds true, where I feel that this is a group of people that I trust, are extremely intelligent, knowledgeable, and that I know that I can turn to, from my peers to my attendings. Being a surgical trainee here at Duke is one of the most challenging, rewarding experiences of my life. It's something where you come in as an intern and you don't necessarily know what to expect, but there's a support of your senior residents and faculty kind of getting you through that. It's getting into the operating room very early on, including your intern year, and having this graduated responsibility through the course of the year where you're getting independence and getting the opportunity to grow. We are very good about being in the OR pretty early on, even beyond intern year, and have rotations in various surgical settings, including our regional hospital, our main hospital here at Duke, Duke Regional, Duke Raleigh, the Veterans Affairs, as well as ambulatory surgery centers within the Duke health system. In our junior years, we get a lot of autonomy in some of our rotations, including at Duke Regional and Duke Raleigh, but we always won't have the support of our senior residents and our attendings, and so we're never on our own. So while we have a good opportunity to grow and kind of come into our own as a resident and as an otolaryngologist, the support is very apparent. By the time we're in our senior years and coming near graduation, we feel confident and competent. And you know, it's kind of fun along the way. You know, you will certainly work hard, but you have a great group of people to joke with, hang out with, and lean on when you need it. Outside of the hospital, in addition to hanging out with my co-residents, I do have a family. I have 2 young children, both under the age of 4, and so I have a family life in addition to my family here at Duke. We enjoy doing a lot of hiking and outdoor activities, which is great being in Durham, because we get a much longer hiking season, really from spring through late fall. It's still great walking weather even in late November. There's a lot of trails locally here, which we enjoy doing, but if we want to do a little bit more mountainous hiking, we do go out west near the Asheville, Blue Ridge Mountain area. We're also a couple hours away from the coast, and so we do enjoy doing that as well during the summer months and going to see the ocean. I own a paddleboard, and me and my husband enjoy doing that on more of the calmer waters as well. We got my siblings as well very into that when they visited us in past years. We also hang out as a residency. We go out to dinner, we hang out, we'll have barbecues and whatnot, and so even when we're not under working required to hang out with each other, we are genuinely friends and do hang out with each other quite a bit. Also, Durham is really up and coming in terms of, I would say it's kind of a foodie area, and so there's a lot of great restaurants both in the Durham area, Chapel Hill, and in Raleigh. We have restaurant weeks usually during the summer, and so there's opportunities for not too high of a price to be trying out a lot of different foods. There's award-winning chefs and quite a variety of food. So, and even on a takeout menu-wide in the COVID era, there's a lot of options, and I've thoroughly enjoyed doing that and experimenting, and cannot complain from the food end. So when I reflect on diversity and inclusion, I think that as otolaryngologists, we are in a unique position to expand the definition of diversity and inclusion. So I see it beyond just thinking of people from different geographical regions, different racial, ethnic backgrounds, which are all certainly a part of our department here at Duke. But I think of all the different specialties that we interact with. We're interacting with our surgeons, our audiologists, our speech-language pathologists, our cancer colleagues, radiation oncology, medical oncology, and multiple other specialties that all really have a seat at that table when we're thinking about our patient care. We're working with our patients on these modalities of communication and how they're navigating within the world, and really all of these different specialties are very important. We're interacting with them in the clinic on the day-to-day basis. We're interacting with them on conferences and when we're deciding tumor boards and treatment of cancer patients. And we're also working with our scientists and thinking about technology and advancing the field. And so all of this kind of interplays in how we are reaching our patients and the world at that. And it's important to have those different perspectives because no one person or one specialty has the answers, but by bringing all the different specialties and all the different backgrounds, we, I think, are treating our patients better and are having more of a realization of all these different factors that is impossible for any individual person or specialty to recognize. In terms of being a global leader and promoting healthcare connections, certainly our specialty being otolaryngologists, we are all about communications, from listening to speaking to smelling, which taste and food and whatnot. But we are also in a situation where our patient population is beyond what we are seeing in our clinic. There are health disparities amongst the world or within our country in terms of healthcare access, and I think that there are many opportunities that we are working here at Duke between machine learning, between global health initiatives and access and telemedicine to try to bring care to patients and trying to do that in a successful manner, not just from a surgical standpoint, but by incorporating all the different specialties within our department and beyond. Being a global leader is about acknowledging those disparities, acknowledging ways that we can improve upon the disparities, and improving upon research and technology, whether it's from the basic science and working on a cellular chemical level to going large scale and providing an access program involving many different people. And I think that our specialty in how diverse our patient population is uniquely in that position to kind of see a larger portion of that picture. And I think that Duke is certainly at the forefront of that field.